So, how much high you must go for developing a alveolar PO2 of 60 millimeters of mercury to bring altitude illness. So, altitude physiology, exercise physiology. In physiology are the two main topics which we are going to discuss down the line for the next batch of students. So, what is your answer? 3000. That's good. Then you are evaluating polycythemia. Polycythemia can be primary polycythemia rubra vera, or it can be secondary polycythemia in anybody who has a hypoxic state, either because of lung disease, either because of congenital heart disease with the right to left shunt, or if a person is living in a high altitude. So you need to take a history, whether he is a smoker, COPD, you need to do 2D echo, you need to do erythropoietin levels. Why? Because if it is polycythemia rubra vera, primary polycythemia, they will be low. Secondary polycythemias, erythropoietin will be high. Iron profile is not done. All the remaining things are done. Bone marrow is done to know erythroid hyperplasia if it is polycythemia rubra vera. Now, doctor, what is the main reason for the DIC? It's called consumptive coagulopathy. So, it is the uncontrolled thrombin generation which will consume all the coagulation factors which lead to development of disseminated intravascular coagulation is what need to be remembered. In contrast nephropathy, you should be careful. Metformin, dehydration, NSAIDs, they are all the predisposing factors for developing contrast nephropathy. Then coming to the Marasmus versus Kwashiorkor. Alert active child with a voracious appetite with a severe wasting with a monkey-like facies is equal to Marasmus is what you have to be very, very sure about. In diazepam withdrawal, what will happen? There can be precipitation of epileptic seizures, there could be hallucinations and anxiety. Any of them can be the presenting feature is what need to be remembered. Then you want to visualize biliary tree. I am trying to run fast on the answers. What is the best investigation you want to use for the diagnostic purpose, doctor? Huh? Very good. It is magnetic resonance. Cholangiopancreaticogram is the one which you have to fundamentally use. What do you mean by trigger finger? Very classical question. Thickening of the flexor sheath not working in police is responsible for the trigger finger. Very funny questions of the examiner. Now, if there is a discharge of the blood from the nipple, what is the most high yield topic in surgery, doctor? Of all topics, read Bailey daily is the rule. So, which topic? Breast cancer. Without a question on breast cancer, there is no paper. You have to be 100% sure on prostate cancer, thyroid cancer, breast cancer. How do you stage the breast cancer? How do you evaluate the breast mass? Everything. So, it suggests either papilloma or a carcinoma and always needs further evaluation is what you need to basically remember. Inguinal hernia commonly in case of the pediatric population is what kind of inguinal hernia, doctor? That's good. Question number 143. 143. Nina answered it wrong from Pune. Our earlier question, she said D, but it is A. Now, inguinal hernia is almost always indirect. It passes through inguinal canal due to the patent processes vaginalis is what need to be remembered. What is Joulefoy's disease? You heard it earlier. What is your quick answer? Joulefoy's lesion, which can be a source of hematemesis. What is your answer? Confident answer. Yes, doctor, you should not take this much time, only 1 week for the MD entrance. Next Sunday is the APPG. Yes. Very good. B. It's a gastric arteriovenous malformation which can be the source of bleeding. Very good. Question number 146. That's right, our online student Fahima also is now shooting the answers. 145B she said, correct. Mucopolysaccharidosis, bone and joints can get affected. Very good. Colored halos are due to corneal edema, cataracts or glaucoma, but not retrobulbar neuritis. Very good. Stewart's granuloma means what? Stewart's granuloma. It's not Wegener's granuloma. What is Stewart's granuloma? Wegener is a vasculitic granuloma, but what is Stewart's granuloma? One confident answer. Yes. Question number 148. Give me one classical answer. It's a sinonasal lymphoma, idiopathic pleomorphic midfacial granuloma of Stewart is what need to be remembered fundamentally. Now, how much weight gain will be there during pregnancy? You can forget about exam. Tomorrow when your spouse becomes pregnant, you must be in a position to decide how much weight gain she is expected to gain during pregnancy. What is your answer? Huh? C. 11 to 16 kgs. Very good. True incontinence is because of true incontinence. Not urge incontinence, not stress incontinence, true incontinence, real incontinence. There is a small abnormal connection and that is leading to incontinence. True incontinence. Not this much time to think when there is one more week exam. No problem. Very good. B. Come out with your confident answer, doctor. Visaicovicinal fistula. Because my idea is to tell you that you prepared very well. Just confidently shoot your answers without second thought. Superior thoracic aperture doesn't have xiphoid process as a boundary. I think cheapest, easiest question in any exam. Now, the salivary gland has exocrine or endocrine function? Exocrine, basically. Then metolazone is a congener of thiazide, diuretic. Then hyperplasia. This is a little controversial question. There are two answers. Option A is wrong. And option D also is wrong. Hyperplasia doesn't predispose to cancer. Metaplasia predisposes to cancer. Benign prostatic hyperplasia we say. Is BPH is a risk factor for prostate cancer? No, no. Huh? So, hyperplasia doesn't predispose, metaplasia predisposes. So, what should we accept? Both A and C should, D, both become accept. Beige average is X-linked recessive. No big deal. Neisseria is not anaerobic. How do you call Neisseria? Neisseria is aerobic, gram-negative, non-endospore forming, non-motile cocci, which you need to remember. When will aircraft accidents happen? We are not asking bedroom accidents, aircraft accidents. During takeoff or during landing? So where can it happen? Very good, during landing. Lot of times. What is that very notorious Mangalore accident? At the time of landing, it went out of the ground. So this question, does it require MBBS knowledge? No, not really required. Huh? So, but why this question is then given in entrance? Because to give you a dream, you will finish your MD, you will be going around the world to deliver your expertise in doing a particular plastic surgery procedure or a cardiothoracic procedure. So be careful to tighten your belts while landing. We want to tell you and give you a great dream. So today you are MBBS. Within another 2 months you will recognize, am I in MD first year? By the time you come out of that embarrassment, you will already be out of MD. And when you are out of MD, you will feel, am I the consultant today? Am I responsible for the life of people? 3 years MD will pass in 3 minutes, doctor. Be very sure. Huh? So, excellent. Randomized control trial. That's what? Like a sure shot, you have to shoot the answer. Dot says short course. Directly observed therapy, short course. Chronic cough means, this is another. Daskatis, lottery question here. Who will give me the correct answer? 160? Yes. 160? 12 weeks you want to say? 12 weeks? Let me see what our online classmates are saying. Fahima also agrees with you. 12 weeks. She proposes. Anybody else? Nina, what is she saying from Pune? What is chronic cough in Pune? Yes. Huh? Pune is very famous for which jail? There is very famous jail, no? Erravada jail. Huh? There is a, just like Chenchalguda here, we have one very famous, the other day while traveling in Pune, he was saying that this is a very famous jail. Huh? So that's good. Nina proposes 4 weeks. No sir, more than 8 weeks. So clean bold. Simple questions. Chronic cough bhi malum nahi hai, entrance ko ja rahe. So you can tell your classmates, you ask the question after going to the reading room, what is chronic cough re malum hai kya? Ye bhi malum nahi, kyun ja rahe entrance ko? Huh? So what is total body iron content of an average 80 kg? Once more, you have to weigh yourself. Krishna Tulabharam, it is called as. Yes, what is your answer? Lucky number, lottery question, 4,000. What do you say? Huh? 2,000, wide difference. Huh? 161, what is the lottery answer of our online students? That's good. Who said 4,000? He is good in numbers. Huh? That's good. Now, what is the major regulator of thrombopoietin? I mean, where is the thrombopoietin basically produced? Easy but challenging question. Kidney, liver, endothelium. Kidney, liver or endothelium? You want to say endothelium? No, sir. Question number 162. Fahima thought it as A, which is wrong. Tirupati thought it as C, like you, wrong. If you go to the functions of liver, any physiology book में 20 functions will be there, doctor. Will be thinking, अरे liver का functions किसको मालूम नहीं? उसमें छोटा-छोटा functions रहता, जो MCQs बन सकता. MELD score. Have you heard of child Pukes classification of cirrhosis? No. So what is MELD score? Does not include what? Who will give the correct answer? Huh? Oh, you can't do this question wrong for this sentence, doctor. This is a simple question. Simple in the sense, examiner's minimum expectation that you should know. Just like ARDS, sepsis, you must know the differences in the definition. Okay, so what is your answer? What is your answer? Albumin, because it is there in banana, in child's classification, it should not be here in this. 163. Tirupati thought it as D. Clean bold. It is albumin. Typically, creatinine and bilirubin are taken into consideration while including model for end stage liver disease. MELD scoring is what need to be remembered.